Namaste, I'm Dr. Mohankumar. I'm a consultant urologist, laparoscopic, robotic and renal transplant surgeon at Apollo Hospitals, OMR. Today I'll be talking to you about the ways of preventing renal stones. Renal stones, we all know, are extremely common in a country like us, especially in a tropical climate and especially in these months of April, May and June. So what are the ways to prevent the formation of stones? So there are a lot of ways to prevent the formation of stones. The first and foremost is the excessive fluid intake. You should take a good amount of water. So people come and ask us, like, how much is the normal amount of water intake, doctor? Should I drink 2 liters? Should I drink 3 liters, 4 liters, 5 liters? We will always tell them that the amount of water you take is not very important. You should be you should always have a check on the amount of urine you pass. For example, during summer, for you to pass around 3 to 3.5 liters of urine, you need to drink at least 4 to 4.5 liters of water, because to avoid all the incessant loss of fluid in form of sweat and all those stuff. At the same time, during winter, for you to pass around 3 to 3.5 liters of urine, it's enough if you take 3 to 3.5 liters of water. So the amount of urine you pass is extremely important. The constant amount of urine we pass keeps the kidneys flushed and avoids the accumulation of the stone forming materials. This is the point number one. The second and the most important point is the lifestyle changes. There are certain lifestyle changes we would advise our patients. The first thing is to avoid oxalate containing foods. What are the oxalate containing foods? There are a lot of oxalate containing foods such as tomato, palak, the nuts, the dry fruits, coke, Pepsi and all those stuff. I'm not saying that you should completely avoid all these things, but you can reduce the quantity and avoid the junk foods like Coke, Pepsi and all those stuff. The second thing is like avoid non-veg, to reduce the non-veg intake. People who form stones can sometimes, the stones can be due to uric acid. Lot of more intake of non-veg can lead to increased uric acid. So these things are important. The next is, a lot of people say that, sir, does calcium lead to formation of stones? No, the studies have shown that calcium, when it is taken in normal quantities and along with food, actually it prevents the formation of stones. Why? Because calcium binds with the oxalate in the food and it prevents the absorption of oxalate. So in an indirect way, calcium which is taken in a normal quantity with the food will prevent the formation of stones. So these are the advice. First is drink plenty of water. Second is to avoid the these oxalate containing foods and uric acid containing foods. What are the foods you need to take to increase to avoid the formation of stones? The juices such as citrus containing juices such as orange, nimbu, mosami and all, you can take it in regular amounts to avoid formation of stones. Then the most important thing is regular follow-up. We always say, once a stone former, always a stone former. Stone formation is also a disease like diabetes and hypertension. A lot of people don't know the importance of regular follow-up. If you keep a regular follow-up with the doctor every 6 months to a year in the initial stages, and after that you can keep following the doctor every year, and we can do a non-invasive investigation. If we find out the stones in a very early stage, we can avoid unnecessary surgeries to the body. So these are the ways to prevent formation of the stones. Thank you.